So VITL is both this designated health information exchange for the state of Vermont as well as a regional extension center for the state of Vermont. And so our work basically revolves around executing against both of those requirements as well as supporting our state level health reform initiatives. We helped the state HIT coordinator develop the state strategic and operational plan, and we have responsibility for actually executing against the operational side of it and the health information exchange side of it. The HIT coordinator is responsible, for example, for the governance. We're responsible for the oversight and deployment of the health information exchange. Our staff actually supports practices in a mode that actually may incorporate functions both of the REC and the HIE. So for example, if we have a clinical specialist who's in a practice helping them adopt an EHR, part of that adoption plan will include connectivity, and that individual will actually work with our exchange staff to ensure that the exchange takes place, but we don't actually deploy sort of separate people into the practice. We like the practice to know that there's one individual that they can count on for all of the things that they require from us. One of the things that has been extraordinarily helpful in Vermont has been the connection between the HIE and REC work we're doing and the state's health reform initiatives, which are fundamentally built around transforming how practice is done. It's frankly a lot easier to have a sustained and productive conversation with providers about how their care will improve and how the way that they interact with their patients will improve based on the health reform initiatives than it is to simply talk to them about technology. And so we've been able to connect that with them on that vision and then use the technology and the federal programs to help accelerate the execution against it. So we look at sustainability in two phases. One is through the phase of the ONC program, so that we get sort of the full build out and the opportunity for our practices to benefit from that program. And then the second is really the extended sustainability. We are very fortunate in Vermont to have a fund that is actually funded through a fee based on medical claims from the commercial insurers, which actually provides the basic financial underpinnings for our efforts, both as Health Information Exchange and for the match component of the Regional Extension Center. That program actually will sunset in 2015, and actually the program has been in place prior to high tech. That's just coincidence that it actually sunsets around the same time. We don't have an explicit plan yet for life after 2015. It's actually a task that we're going to be working on very actively over the next months to years. However, we see that, in fact, a number of things are going to have an impact on how we sustain. One is that reimbursement is changing in Vermont. We anticipate it will be changing nationally. And some of those changes are going to reward practices and providers who are active and effective users of electronic health records and who are able to demonstrate better care for their patients. We're hopeful that in that environment there will be some useful models and a recognition of the value both of the exchange and the ongoing support of the Regional Extension Center. Obviously, the ONC program is only going to take us so far in terms of connecting up primary care physicians. There are still a lot of providers, both medical providers as well as other health professionals who are going to be part of our health system, are part of it today and will be part of it tomorrow. We see an important role in connecting them, which is going to carry us well into the future. I think at this point we are relatively under-communicating with our patients. We have some plans in mind over the next few months to actually increase our outreach to patients so that they really understand what we're doing. Part of our program obviously is very focused on ensuring that their information is getting to the providers that they're seeing, but we want them to understand how that works and to ensure that their trust is there. So we anticipate building that out over time.